Hey everyone, and welcome to this explainer. We so often talk about healthcare in terms of these massive, abstract policies or grand national systems. But today, we're zooming all the way in. We are heading straight to the Osmaninogor Upazila in Sylhet, specifically looking at the Howar Basin. We're going to examine how a single, incredibly well-placed initiative completely changed the game for an entire community's survival and health. The story we're looking at today is honestly an absolute masterclass in how targeted infrastructure can literally save lives.
Okay, let's dive into this. What actually happens when geography completely cuts you off from medicine? It's a pretty heavy question, right? But for thousands of families living in this specific part of Sylhet, this wasn't some philosophical debate you have in a classroom. It was a terrifying daily reality. The Howar Basin is known for its really unique and incredibly challenging geographical isolation. You're not just a quick 10-minute drive away from an urgent care. Before 2018, this isolation meant residents were basically trapped when an emergency hit. You layer extreme poverty on top of that physical barrier.
To really grasp how amazing the solution is, we have to fully understand the depth of the problem first. Think about it. For most of us, a simple medical need, like a fever that won't break, a minor infection, or just a routine checkup, is just an errand. You go to a local clinic, get a prescription, and you're done. But in the Howar Basin before 2018, that exact same simple issue would rapidly snowball into a family's absolute greatest crisis. With zero local infrastructure, a simple illness meant you had to figure out how to transport a sick loved one across some really difficult terrain. You're losing days of work, losing wages, and facing just massive uncertainty. It turned entirely treatable everyday bugs into life-or-death emergencies.
Families were basically backed into a corner, navigating rigorous, exhausting processes and paying for services far beyond their reach. I mean, just think about the physical toll of that for a second. You're already sick or you're carrying a sick child, and now you have to endure this grueling journey? It's unthinkable. And the financial hit? Totally devastating. They had no choice but to pay for services that just absolutely shattered whatever meager savings they had. Seeking even the most basic healthcare was practically designed to keep marginalized families completely locked in a vicious cycle of illness and poverty.
The 2018 turning point. Let's move to and see how this builds. Because things finally started to shift for the people of Osmaninogor thanks to the Society for Sylhet Resource Advancement Community, or SRAC for short. They saw this massive gap between the people and their basic right to health and decided it just couldn't be ignored anymore. So in 2018, they established the Shishu Clinic. But here's the kicker. It wasn't just randomly dropped into the community overnight. It was built on a largely invisible but totally crucial foundation, 20 years of prior groundwork. For 2 decades, SRAC had been right there on the ground, building up immense trust and deeply understanding the region. So when those doors finally opened in 2018, the community already knew them. That trust was everything. You can build a shiny new clinic anywhere, but if the locals don't trust the people running it, those waiting rooms are going to stay empty. SRAC's 20-year dedication is exactly why this clinic became an instant lifeline.
Fast forward to today, and the Shishu Clinic is the complete opposite of that bleak pre-2018 picture. It's a fully equipped center bridging that gap for marginalized folks, relying on 3 really fundamental pillars of global health. Let's break down the alphabet soup real quick. First, ANC. That's antenatal care. Basically, it's medical care during pregnancy to keep mom and baby healthy. Then there's PNC, or postnatal care, the supercritical care for mom and newborn right after birth. And finally, EPI, the expanded program on immunization. That is the essential push to get kids vaccinated against preventable diseases. Getting these 3 things right means protecting the most vulnerable members of the community right from day one.
And because they offer all of this under one roof, it creates a truly holistic ecosystem of care. Beyond just the comprehensive ANC and PNC, they're providing crucial reproductive health services. But honestly, one of the biggest game changers here is institutional delivery. Mothers no longer have to take the terrifying risk of giving birth in unequipped, completely isolated settings. Add in being a vital hub for the EPI, and this clinic is acting as a literal shield for the next generation. It's an integrated, top-to-bottom network of maternal and pediatric support.